This is a 980 nanometers 2-in-1 multifunctional laser therapeutic instrument. It has the function of removing red blood filaments and gray nails. It can remove the root-shaped reticular red blood filament (TS) on the face on the spot. The effect is immediate. The fungus is killed by irradiating the diseased nail with a laser without damaging the normal tissue. Let's introduce the installation and operation process of the 980 nanometers 2-in-1 multifunctional laser therapeutic instrument. This is the host. This is the foot switch. And this is the power cord universal. This is an optical fiber hand tool. This is 2 red blood removing treatment heads, 2 different shapes, 1 straight head and 1 elbow, which can be selected according to personal habits. This is the treatment head for gray nails. This is the focusing ring used to adjust the size of the light spot by 0.2 mm to 3 mm. The thicker the focusing ring is used, the larger the light spot is. This is the laser glasses which the operator should wear. And this is the eye mask which the customer should wear. Connect the power cord to the power socket. Connect the foot wire to the foot socket. Connect the ice hammer to the ice socket. When connected, the machine can be switched on without adding water. There is no consumable material and no gel is needed. Now turn on. The instrument loads automatically into the main interface. There are 2 buttons in the main page, which are the red blood removing page and the gray nail page. Click the red blood removing button to enter the red blood removing operation page. And click the back button to return to the main page. The interface is very simple. There are 3 parameters in total: power, pulse width, and frequency. Click the plus and dash buttons to adjust the parameters. The power value is the strength of energy. If the value is too small, it will not work. If it is too large, it will burn and blister. Common range 6 to 12 watts. Pulse width is the time that the laser stays on the skin. The minimum is 15 milliseconds. And the maximum is 100 milliseconds. When operating on the skin, the value is too small to work. When it is too large, the pain will increase and blister. The common range is 30 to 60 milliseconds. The frequency is the number of lasers emitted by the laser per second. The minimum is 1 Hz and the maximum is 5 Hz. This value is related to the skill proficiency of the operator. If the frequency is slow, the hand should walk slowly. If the frequency is fast, the hand should walk fast. 2 Hz is commonly used. This light bulb is aiming light. Click this button to adjust the aiming light brightness. The first gear is weak, the second gear is brighter, and the third gear is particularly bright. Generally, the first gear is cell acted, so you can see the red blood. If it is too bright, you can't see it clearly. This is the number of rounds of laser output after the startup. Here is the total number of rounds of laser output of this instrument. Click the start button. Step on the foot pedal, the laser starts to output. Release the foot pedal, and the laser stops output. If the parameters are not appropriate and need to be adjusted, it is necessary to return to the suspended state before adjustment. For example, increase the energy or pulse width. And click Start again to retreat. This is the operation method of removing red blood. When removing the gray nails, replace the gray nail physiotherapy head and tighten it with a 0.2 mm focusing ring. The mode can be selected as required, and the common pulse mode. The power value is usually between 15 watts and 25 watts. The pulse width value is usually between 30 and 40 milliseconds. Frequency values are usually 5 to 6 Hz. The laser starts to output, the lens is aimed at the sick nail to be irradiated. And the vertical distance is 1 centimeter. The nail will feel hot. The specific treatment time is subject to the fact that it is warm but not hot and the customer can accept it. In the process of treatment, the customer should be constantly asked about the customer's feelings and the degree of tolerance. Each nail was irradiated 1,500 times. And 10 nails were irradiated in turn. Only 1 round of irradiation was conducted every day. Do not irradiate every day. Treat once a week. The treatment cycle is half a year to 1 year until the whole new nail grows. For more serious onychomycosis, the effect of combined drug therapy is better. In addition to irradiating the sick nail, it can also irradiate the skin around the nail, which can sterilize and diminish inflammation, improve the humid environment around the nail and reduce the breeding of bacteria. When applying ice, use ice hammer. When the instrument is powered on, it can use the ice compress hammer. It has nothing to do with the screen program. Long press the switch on the ice applying hammer to turn on the ice applying function. If the ice compress hammer is switched on for a long time, the ice compress hammer's surface temperature will be lower. It should be adjusted properly according to the specific situation. And the time should not be too long. If the patient has adverse reactions during the ice compress, it should stop immediately. Ice application should be stopped for skin pain lasts for 5 minutes to prevent frostbite. This is how the ice hammer works.